Well, hello. It's good to be with you today. I'm pleased to be here and be able to speak to you. My name is Dr. John Wenzel. I'm a extension veterinarian with New Mexico State University. I'm a New Mexico native, spent the last 20 something years in private practice, in full-time private practice in the Silver City area, doing mostly ranch work, and now I do part-time practice and work with New Mexico State University as their extension veterinarian. And what I want to talk to you today about is how important it is to have a relationship and include your veterinarian into a role that helps you and assists you. And I think that understanding what a veterinarian can do for you as a rancher or cow-calf producer or whatever aspect of the beef industry you're in, a veterinarian can be a real asset for you and a real resource. And I think I'm just going to go through some of the things that I have found over the years that I am really able to assist my clients with and what some of the things that I do have an area of expertise in that can help you. And so what we're going to try to do is touch on the reason you need to have a veterinarian involved with you today. And so to begin with, next, what I want to visit with is just some of the general topics that a veterinarian can help you with, and things like vaccine protocols. This is all part of a herd health management program, and there's many aspects to it. Just vaccine is not a herd health program. There's a lot of things that go into it, and so vaccines, and that is a really important part of what I do because vaccines need to be very, very targeted. Both the type and the administration, the timing of vaccines is extremely important because the whole idea is to make sure you immunize as many animals that you can. And so there's a lot of factors that go into that. And so the opportunity to have veterinary input is something that can really assist you in improving your vaccine and the response to those vaccines when you do vaccinate. Mineral supplementation, feed supplementation, we can certainly assist you with some of that, making recommendations and talking in general terms. Most of the time, what I do is I have the ability to tap into a lot of different experts in these fields. I know a lot of them, and so generally speaking, what I try to do is involve those subject matter experts into the management team, so to speak, to help you make the best decisions for your particular operation. And I think that's very important. Nobody's the same. And so it has to be really tailor-made for your particular operation. A veterinarian is extremely important in developing the biosecurity plan for your ranch. That is going to be discussed today a little later, but it's a really important part of what we do because obviously we do not want to bring disease onto a ranch, or if it gets on your ranch, we want to be able to biocontain that disease so that it doesn't spread to others. And so the veterinarian is very important in that aspect. Of course, we do emergency work. If you have death loss or stuff like that, it's always important to have your veterinarian help you with that. We do have the ability to tap into veterinary diagnostic laboratories and submit diagnostic samples, which is really important. And especially nowadays, one of the most important things that a veterinarian can help you with is how to use antimicrobials judiciously. This is a big topic now in the industry and should be. It is a very important thing. And so, the veterinarian, you should always ask a veterinarian about which antibiotic to use and why. And there's a lot of discussion that takes place to be able to do that. But it's really important to be really, really judicious on how we use antimicrobials now. And all of this is based into the veterinary client patient relationship. That is the keystone for all of this that we're going to talk about. Next. The veterinary client-patient relationship, this is the AVMA's definition of that. There's basically three parts to it. One is the first bullet point there is that, I accept the case and I'm going to talk to you about it and you're going to follow my directions. That's really what it boils down to. It's the middle bullet point that's really important, that there's sufficient knowledge of the animals by the veterinarian to initiate either a general or a preliminary diagnosis, which means that the veterinarian is personally acquainted with the care and keeping of the animal or sees the animal directly. That's important. That's changed. That is different than it used to be. I mean, the VCPR has always been there, but the enforcement of it is different nowadays than it used to be. So the veterinarian has to either see the sick animal or be on your place enough to understand the care and keeping of the animal, and that the veterinarian is readily available for follow-up. Next. When we talk about judicious antimicrobial usage, that's a major part of what a veterinarian should be helping you with. Antimicrobial resistance is real. It is a significant problem, and it is a danger to both animal and human health. And so knowing how to use antibiotics correctly is really important. So make sure you communicate with your veterinarian to do that. And also, I try to educate my clients as to, what systems are involved and all that, so I can get as much quality information as I can before I make the judgment as to which antimicrobial should apply in this particular case. And it is on a case by case basis. You really need to not mass treat. The days of, oh, just give them a shot of something and we're good, that's gone, especially as of June of 2023, when over-the-counter antibiotics became script or prescription drugs. We don't do that anymore. We make sure that what we do is we use the antimicrobial that's the best for this particular case, irregardless of the economics of it. It's something that we really need to be cautious with. Next. So with that resistance problem, it's so important for us now to understand that this is serious and it should be taken seriously by all aspects of the industry. There's lots of judicious use guidelines out there. BQA, if you're BQA certified, BQA has a set of judicious use guidelines that are really important for producers to follow. Resistance is not a new problem. It's been there forever, ever since the world was created. And when we use antibiotics, it actually selects for resistance. And so we need to make sure that what we are doing is correct and that we follow the directions. It is your responsibility of cow-calf producer, in my opinion, to develop the calf's immune system so that we don't have to use antibiotics farther down the road. And we all know that. We know that if a calf stays healthy, they reach the genetic potential of their quality much better and much more efficiently than an animal that gets sick. So just keep in the back of your mind that selection and resistance is a highly complex problem. Next. One of the things that I feel like that I can really assist producers with is reproductive efficiency. I think this has probably one of the greatest economic impacts on the ranches that I work for. First of all, is a breeding soundness exam on the bulls, and I just pulled some information out of records that I've had over the years. The first time I go into a herd and do breeding soundness exam, the average was about 22% of the bulls are culled. If I do follow-ups, if I'm annually testing, it's much, much lower than that. 7 to 12% was the average, but a lot of them, the lows are 1 or 2%. And so we have to realize that by doing those kinds of things, breeding soundness exams in our bulls, we are actually going to not waste our rangelands on bulls that are shooting blanks. And then pregnancy checking, to me, that's an extremely valuable part of what I do because it costs so much money to run a cow that's open. If she's not producing the calf for you, it is a tremendous economic drain. I just talked to my ranchers that I work with this in preparation for this, and a lot of the ranches in Southwest New Mexico told me that their cow cost is about $865. We've been in a drought for 20 years. And so one of the biggest costs that we have right now is a hay bill. And but with the land cost and all the input costs that it takes to run a cow right now, it's a little over $800 to run a cow. And so if she's open, she is really an economic drain for you. And over the last several years, especially in this drought that we're in, our percent pregnants have been running anywhere from 8 to 15, but closer to the 15% opens, especially the last 3 years. And so with that, you got to understand that that's a large number of animals that are not going to be an economic revenue generator for you. And it sure is certainly better to move them out as quickly as you can discover them. Next. So the last thing I want to touch on is a little bit about biosecurity. I'm going to open that door, and the reason I think it's really important is I'm going to give you an example of trichomoniasis and what it's done in New Mexico. It became reportable in New Mexico in 2005 because the incidence of bulls that were tested was 6.5%. It's a very complicated disease, which is why I have it here. It's an extremely complicated disease that your veterinarian needs to help you with. There's a lot of decisions that have to be made associated with trick, and you really need to have veterinary input to assist you in those decision makings. It's complicated because there's two different types of infection in the bull. There's an acute and chronic infection. They're different. And so that makes test interpretation really a challenge. And so your veterinarian needs to be in tune with your management and your operation to help you assist you in the test result interpretation of those test results. And so the chronic infection is the one that we're the most concerned about because that is a real problem in the disease characteristics and why do they develop a chronic infection, and which is not for this discussion. But one of the things that really matters is when you test bulls, you may get differing results. Like you can test a bull and he's positive today, and a week later he's negative. Well, why does that occur? It's important to understand that a negative trick test means that there was no bug in the sample. That's all it means. Now, there's lots of reasons why there's no bug in the sample. Maybe the bull is truly negative, but also that organism has a tendency to cluster and its numbers wax and wane. So if we happen to scrape that bull and we don't hit a cluster and its numbers are way down, we may not pick up any bug, even though we've done the collection properly. Well, the test will have a negative result. So basically, remember, if a test is negative, it just tells you there's no bug in the sample. It doesn't really tell you that the bull doesn't have the disease. It's really important to understand that. And that's why your veterinarian has to help you. Next. So in New Mexico, we did a lot of work on trick and we've done a lot of work and made a tremendous amount of progress. But this is where it hurts you. There's the direct loss of the positive bulls, the cost of testing and feeding, replacing those positive bulls. Obviously, there's more open cows when you have trick on your premise, and your calving weights, your weaning weights are much lower because your calving interval is really spread out. And so we did some work in New Mexico. Next. By with some surveys that we did. And this is what I found from the places that had trick. We sent out a survey, had a great response. So before they had trick, the percent weaned calf crop was about 91%. During trick, it dropped to about 65. Afterwards, they picked up pretty quickly. But look at your cow conception and the number of cows culled. This is a very devastating disease. And biosecurity is so important with this one. Next. Here's some additional costs that people don't consider. They think about the cost of testing, and you can see $48 a bull for the test. That's been a few years. It's higher than that now. There's additional feed and labor, but if you look at that, look at the cost of additional bulls that having to replace the bulls that were culled that had the disease. The range was 3750 to 200,000 with an average of 75,000 per ranch that was affected by this disease. Next. So when Dr. Jerry Hawks is an ag economist in New Mexico State, he's now the associate dean at Casper College in Wyoming. But he has an economic model, computer model that he's used in New Mexico for a long time. When we fed all the economic data into that economic model base, and it changes every year because he changes the input costs each year. But in the year that we did this survey, this is what the cost was to have the disease on your premise. There was a difference of $401 per cow compared to a ranch that did not have trick. If you can afford a loss of $400 a cow, you can't stay in business that long. And so it's really important to understand biosecurity, veterinary help, veterinary advice is something that can really help you both economically and to keep you viable and make you sustainable in the ranching industry. And so remember, your veterinarian is an asset to you. And I can't stress how important it is to include that asset into your ranching management scheme so that they can help you with some of the decisions that under their area of expertise that can help you make your ranch more profitable. Thank you for being with us today. And I'll answer questions if there are any.
All right. Thank you, Dr. Wenzel. My name is Dr. J.J. Goycochea. I'm currently the director of Nevada Department of Agriculture, but much like John, I had a career in private practice. I spent about 25 years in private practice in Oregon and Nevada, and a little bit of time in Nebraska and South Dakota. I was also a state veterinarian for the Nevada Department of Agriculture before coming over to be the director. So I'm going to weigh in just a little bit more on biosecurity and why it is such an important topic today. Next slide, please, Julia. You know, John talked a little bit about trich, and obviously you can see the economic ramifications that's going to have. But what about some of these other diseases? They're going to be a lot more devastating to your operation and the nation as a whole when we do see those introduced. So this slide here is just some snow geese. I don't think anybody here is grazing snow geese intentionally on their grazing land, but obviously this is something we want to be aware of. High path avian influenza, if you haven't heard about that in recent months and over the last year or two, I don't know where you've been. That is a disease that has really scared a lot of us veterinarians. And how did it get here? Well, it obviously it's circulating in the wildlife. So while we talk about biosecurity plans and enhanced biosecurity, we better be paying attention to what the wildlife migration looks like. That high path has an affinity for dairy cattle right now. Thankfully, we haven't seen a lot of it in the beef sector or any of it at all in the beef sector. But I want you guys to be thinking about what am I going to do as far as I start creating a biosecurity plan, and am I going to be looking at wildlife? Next slide, please, Julia. Along those lines with that wildlife, everybody likes to hunt. And I didn't put this picture in here just as a reason to show you this nice buck that this kid got. I want you to be thinking about something else with biosecurity. The young man in this picture, 48 hours before it was taken, was horseback on my ranch in northern Nevada, helping me move cattle home. Rangeland, pasture, grazing operation. We got those cattle home. He took off and he went hunting. 24 hours after this picture was taken, he was back in northern Nevada in my yard talking to my wife and daughters while the farm flock of sheep were meandering around his pickup and his horse trailer. The bummer lambs that they raised on their bottles were there being a regular pain in the butt that they can be as they walked around there as well. Why do I bring that up? Why is that important? As we talk about biosecurity, Dr. Wenzel talked about the neighboring herds and watching your introduction of livestock. Biosecurity and enhanced biosecurity goes a lot farther than that, folks. It goes to who's coming on and off of our operations. We never thought for a minute that Joel here was going to be of any concern. Who would? We know him. He day works for us. He always works for us. Many of you are going to have that same thing. Your neighbors, your friends, your families, they're coming on and off of that operation. But there's always that chance that we're going to see an introduction of some kind of a disease, something a lot worse than trich. That's going to cause us some problems. A foreign animal disease, God forbid we get foot and mouth disease, and it can move quite rapidly, and it can move on the boots of Joel. It can move on the tires of his four-wheeler. He went horseback here. It can move on his horse. We have no idea where he cleaned him, what he cleaned him with, if he cleaned him. We know where he started. We know where he went. We know where he came back. Nobody's asking me to track the movement of my employee like we're tracking the movement of our livestock. I want you to think about that in your biosecurity plan. Next slide, please, Julia. And why that's important. So for foot and mouth disease, it will be economically devastating to your operation and to the industry as a whole if we don't have a way to stomp it out quick, get it contained. Dr. Wenzel talked about that containment piece in biosecurity. We want to keep that from spreading off if you're the one to have it. More importantly, we want to keep it from coming on to you. Next slide, please, Julia. So nuances for ranchers with grazing, and this is for federal public lands. A lot of us did a lot of work on that. This applies to all kinds of grazing land. So we're a grazing land coalition group that we're talking about here today. I don't care if it's private land, public land, what it is, there's some nuances, and we want to steer you in that right direction to see those resources. Julie, next slide, please. Go ahead, you can clip right through these. So at first, we're going to have a national movement standstill when we have foot and mouth diagnosed. What's that look like? There's going to be a mandatory 72 hours. You're not going to move. You're not going to go anywhere. Hey, we're on grazing land. 72 hours isn't that big a deal. Well, isn't it that big a deal? What time of the year is it? Do you already have a plan moved? Are you trying to come home and wean? Or are you trying to ship? How are you going to get those cattle home? Are you going to truck them home? Or are you going to drive them home on the ground towards your shipping corrals? Where is that shipping corral at? God forbid it's in one of our control zones. It's in an infected zone. You're not coming in or out of there unless you have a good biosecurity plan in place and we can permit some movements and make sure that you're safe. Next slide, please, Julia. So back to that previous slide, you don't have to go back. I really wanted you to see that bullseye in there. So we have an infected area in the middle of that, in the middle of that map. We're not, as animal health regulatory officials, we're not going to let animals come in and out of there. We're testing out, we're trying to control that. If you happen to be in that or adjacent to that, you're going to be on the phone with the state veterinarian, and you better have your veterinarian dialed in on what your biosecurity plans are from the beginning. A valid veterinary client patient relationship is obviously something that you're going to have. I want to know if your veterinarian knows where you're moving, why you're moving. Is this a biosecure place that you're moving to? What does that biosecure place look like? Do you have it mapped? How do you come in? Who comes in? Who goes out? Do people know how they're supposed to come in and out of your operation? Do you have a plan to feed those cattle? If I tell you you're not moving for a week, a month, 2 months, how are you going to get that feed in there if you don't? These are all things that you need to be thinking about today. We don't need to be thinking about them when the disease comes, because that is going to be too late. I am not going to allow you to move as a state veterinarian, as an animal health official, if you tell me I don't know where I'm going, I don't know where I'm going to do for sure. I need to know up front on day one that you have a plan and you know where to go. Next slide, please, Julia. So Dr. Wenzel talked about that vet client patient relationship. Guys, this isn't anything new. And the only reason I put this picture in, I thought it was funny. As I was doing some research for this presentation, I actually just did a little Google search of VCPR. And this was one of the first things that came up. This is almost 10 years old. I have no idea what this article was about. I just found it on the internet, but that is me in a different life with a lot less gray. And I am doing exactly what Dr. Wenzel talked about. I'm examining a cow. I'm on a ranch. I know the ins and outs of that ranch. This might be what your veterinarian is called to do. If we have a disease outbreak, let's look for some clinical signs. Let's see what that looks like. But more importantly, I need to be an asset for you as a veterinarian, that I have looked at your plan, I've looked at your operation, and I can help you move when we have this disease outbreak. Go ahead, Julia. So if there's one thing you haven't seen yet this morning, economically, biosecurity is going to cost you a lot if you do it wrong in the case of trick. Another thing, it's going to cost us as an entire nation, as in an industry, if you don't have a plan in place, and you will not be moving and you will not go to market, and you will have a severe financial impact if you don't start today and come up with an enhanced biosecurity plan and a secure beef plan, and operate within those guidelines from this point going forward. With that, I want to turn it over to Dr. Herman. I'll point you in a little direction on some other resources and assets that we have for you.
Awesome. Dr. Wenzel and Dr. Goyachia really set me up well. I think you can see how veterinarians can play a role on your on the daily aspect of your operation, but also on a national aspect in case of a foreign animal disease. So I'm here to show you some resources that are already developed if you haven't taken advantage of them already. I know some of you are going to be sitting in on the BQA training later this afternoon that Dr. Wenzel is going to be working on. So, but here are some things that you can look at once you get home. I do want to start off with the Beef Quality Assurance Program's mission, which we guide producers towards continuous improvement using science-based production practices that assure cattle well-being, beef quality, and safety. All of us in the cattle industry care about these animals. We care about the how they go about their daily life. We care about the product they produce. We also care about the people who are producing those cattle. So that's what the BQA program is here for, trying to build on that continuous improvement in all aspects of the operation. Everything about the BQA program is prevention, and that's what both talks this morning have already talked about. Everything is about prevention. How do we know there is a risk? Trick is a risk. We know that's a risk. How do we prevent trick? That's what BQA is trying to do with a lot of different diseases, but that goes anywhere from vaccine use to specific disease guidelines to zoonotic disease. So protecting your humans from different diseases, all of that is part of that prevention. BQA recommends that all producers have that resource group. And so that could be your operations supervisors, veterinarians, obviously, are, biased, should be in there, nutritionists, extension specialists, the grazing specialist, anybody who is an important outside set of eyes on your operation. That's part of your resource group to help you, to challenge you to be better. BQA, we know that BQA started as injection sites, looking at injection sites and residues, but it's really evolved into a total quality management program. So we have all these different topics that we cover in the BQA program, from behavior and handling to herd health management to nutrition and grazing to worker safety. We have something for every operation, regardless of how you produce your cattle. You are already going to get, well, for those of you who aren't going to get certified, you can go online and look at our online certification courses, or attend an in-person. We have multiple different courses you can take. We also have a transportation specific one. But this is what we're really excited about. This just came out in the last few weeks, but our new national manual has really upped its focus on human safety and training. We have a lot of description of why behind we recommend what we recommend. And then there's lots of QR codes with references that you can further research and do more fine tuning of your herd health plan. All of our resources are available on bqa.org, from the national manual to the field guide to self-assessments. That antibiotic stewardship for beef producers contains those judicious points of judicious use that Dr. Wenzel talked about, and then also that biosecurity plan. We have transportation specific modules for any of you who are transporting animals. We know that haulers play a huge role in the welfare and the quality of our animals when they're going to the packing plant or when they're going from pasture to pasture. So those are some great tools for you. We also have continuing education modules. So if you're already certified, you can go online and check out these modules and get more in-depth training in specific topics. With biosecurity, I think Dr. Wenzel set it up really well, like starting at your operation, what you can be doing on a daily basis, and then stepping that up to in case there's a foreign animal disease, like Dr. Goygachias talked about. So BQA really gets the foundation of biosecurity in all of our modules and our manual. We step that up with our daily biosecurity plan in our online continuing education module, where you dive into what are the risks that are coming onto your operation. What can you control? That's what biosecurity is about. What can you control? And then all of that prepares you for filling out a secure beef supply plan that is going to be needed for that foot and mouth disease outbreak. These are fillable templates that can be downloadable, and you can either print them off or fill them out on your computer. The secure beef supply plan is something that I encourage all of you to take advantage of and go learn about. NCBA has a grant to help improve educational resources on the secure beef supply plan website, but that includes a lot of those public lands documents and public lands recommendations that JJ talked about. The BQA program also our producer education program also has stockmanship and stewardship. We have YouTube videos and cattlemen's webinar series that all play into different aspects of raising those animals that you are so proud of, and we are thankful for everything that you do. But if you have any questions, please, I'm going to punt it to Dr. Wenzel and Dr. Goygachia, but please contact us if we can help you with anything. And thanks for listening.